So with Brain Talk Live today, any day really, our objective is to give you tips on what you need to do to stay healthy, what you need to know about Alzheimer's and related dementias, and anything else that helps to make our aging journey a little bit more positive and better, particularly for those of us who may be experiencing cognitive change or living with somebody who's having trouble with their cognition. Today, and for the rest of the month of October, you're going to be hearing more from people and organizations that offer some support and comfort to those families who are living with cognitive impairment. Our guest speaker today is Ms. Deborah Zisholtz. I'm hoping to apologize for mispronouncing it, who is going to talk to us about Aviv Older Adult Services. These programs include things like caregiver support, geriatric care management, memory support, and other supportive services. So we are going to hear from someone who is a social worker trained at Boston University, who's going to talk to us about the services that are available to families of persons living with cognitive impairment and just aging in general. Ms. Zisholtz, thank you for joining our program today. Hopefully you can share with us a lot of information we haven't had before. Ms. Zisholtz? Okay. Marissa, is she okay?
I'm here.
Okay.
All right, thank you. Nice to see everybody this afternoon. Today I'm going to be sharing with you an overview of the services provided through Aviv Older Adult Services at Jewish Family and Career Services. My understanding is that many of you are service providers yourself or have someone in your life you care about who is an older adult. So I want you to keep in mind a few questions as I go through my presentation. First, are you aware of the full range of services available for older adults and caregivers in your community? What barriers do you face in accessing services or resources for older adults and caregivers? How do you determine when it's time to seek outside help, such as care management or counseling for an aging loved one? And finally, what services do you wish were more readily available or accessible for older adults in your care? I'm trying, I think I have control. Are you going to be clicking it for me? Okay. So I'm going to start actually by giving you a little bit of Aviv Older Adult Services is part of a larger organization called Jewish Family and Career Services. So it's a multi-purpose social service agency, and it's been serving Atlanta since 1891. Our mission is to transform lives with a wide range of client-centered, outcome-focused programs for all populations. And these can be individuals who are Jewish or not. Just because we have the Jewish in our name does not mean that we only serve older adults who are Jewish, or even clients in general who are Jewish. That's not the case. We provide our services with Jewish values, Jewishly, not necessarily only to those individuals. So JFNCS is a one-stop shop that provides services through an integrated program model. We have not just Aviv Older Adult Services, but we have clinical services. We have careers, supportive employment. We also have services for individuals with intellectual and developmental disabilities. And we also have our Ben Massel Dental Clinic, which serves low-income individuals in our Midtown location. Additionally, participants can receive emergency assistance. We also have a kosher food pantry, and we also offer information, referral services, and other resources. Next. So let me tell you a little bit about what we do in Aviv Older Adult Services. Our goal is to help older adults age well in their optimal environment and to support family caregivers in their efforts to care for their aging loved ones. So we do this in 3 different ways. To accomplish this goal, we help them navigate life transitions, access community resources, and provide opportunities for social connectedness. All of our services are aligned with one or more of these goals, and you'll see that as I go through the rest of these slides. So first, if you could change to the next slide. Let me give you a little bit of our information regarding our scope of services. With Aviv Older Adult Services, this particular service area, it wasn't created until 2006. And we offer 10 different types of services and have at least 30 staff. Again, we serve over 1,000 older adults and family caregivers, and we really try to leverage our services, not just within the services that I just mentioned within JF&CS, but also through leveraging funding and resources provided by many of the providers that we work with. We collaborate with multiple service providers, congregations, nonprofits, for-profits, government agencies, and many community centers to leverage this support. Next, thank you. So in preserving independence for older adults, that's something that we really want to try to do as much as possible. So we help them navigate the aging services system. We coordinate services, we provide care plans, we implement and update care plans, and we help clients access services. We do this through case management services and our geriatric care management. Case management primarily focuses on our low to moderate income older adults. Case managers help clients access government benefits and other community resources, as well as help coordinate services. Many of the grants that we provide offer financial assistance. And right now what we're finding is that affordable housing is one of the most critical needs that many of our older adults are facing. With GCM, which is our geriatric care management, it goes a little bit further than case management. It's designed as a fee-for-service offering, and it's developed around the individual or the couple-specific needs. We offer hourly consults, and we call these resident and family support consultations. We discuss the support. The way that we provide the support for these consultations can oftentimes include sensitive topics, things like relinquishing driving, elder resistance to in-home support, considerations for transitioning to an assisted living or memory care community setting. These are things that a lot of times families will call and they just don't even know where to start. They just want someone to guide them or answer some of their questions. And so a consultation tends to be what they need. And then through that, they may decide, okay, do I want to implement some of these suggestions or referrals on my own, or do I want to hire someone to be able to do more for me, to help me actually meet some of the things that have been just referred to me? So for example, the first thing that's done or can be done is an assessment or a care plan, which provides a roadmap to identifying what supports are needed and also to support health and safety needs and identifies providers that can fulfill those needs. Another way that we can support individuals is by overseeing and coordinating those actual services that we put in place. And those services can be provided to clients no matter where they live, whether it's in living still at home, in an independent living facility, in a nursing home, or in an assisted living or memory care. We coordinate and we can attend doctor's appointments with written follow-up reports. We facilitate transitions into facilities, including those long-distance moves. And we can also help with family mediations to facilitate really difficult conversations between family members. And we also can advocate on behalf of the client with care providers to secure quality care. Next. We also offer a core number of services that provide caregiver support to our families. And one of these, in addition to the two that I just mentioned, is our respite voucher program. It offers financial assistance to caregivers for home care and also for adult day support. We also offer individual counseling as well as groups. We take most insurance, and we're also able to provide the counseling services not just in our office online, but also in a client's home. which is different than a lot of other places. Caregiver support groups, they can be for those experiencing, those with clients that they're caring for with dementia, or they can be more generally focused on caregiving in general for older adults. We do have a screening process for those groups to determine what group is most suitable for a caregiver's needs. Groups also provide an opportunity for caregivers to process through caregiving challenges without judgment and to learn from others who are in similar circumstances. There's really no charge for participation. And I don't know if I can share, a handout or not. If I share on my own, Ms. Parker?
Yes. Let me stop sharing and I'll relinquish control over to you.
Okay, I just want to show this real quick. Okay. Are you all able to see this?
We cannot.
Oh, okay, let me try it again.
Okay.
There you go.
Yep, we can see it now. Thank you.
Okay, so these are just some of the caregiver groups that we're able to offer. And as you can see, some of them are in person, some of them are online, and we offer them at various senior living communities. Some are sponsored specifically, through our agency. So we do partner with other places to be able to offer these groups, and we're always looking for new places to offer them. So if you work with the senior living community and you'd like to see one of our groups in one of those in a new location, please reach out and let me know. We're always looking to partner. Now I'll go back. I'll stop sharing and you can go back to the presentation. Thank you. Okay, and you can go to the next slide. So these are our memory support services. And these are services that help to reduce client anxiety, confusion. They help to retain the memory that people still have. They promote social stimulation, well-being for people living with mild cognitive impairments or dementia. And the first one here is our Brain Health Boot Camp. It offers a 2-hour on-site intensive cognitive stimulation and chair exercise program. We do screen for appropriateness. We have we have 3 different classes. We have one that's more early memory loss type of for those with early memory loss, and we have others with more moderate memory impairments. And classes are about $25 a session. We do have some scholarships we're able to offer. The program, it addresses the gaps in the services for those with early memory loss by providing a combination of both physical exercise and mental exercise, and it's in a social group setting. And it's provided in a series of 8 weekly classes. Our music and memory program is a program providing people with other cognitive impairments with personalized music programs that are tailored to their preferences in the era. And it can really help to reduce agitation and help people feel really calm when they're maybe experiencing something like whether you have a home care worker who's providing some assistance, or during a time when a family caregiver is trying to get the person to do something they wouldn't otherwise enjoy doing. It's a nice way to be able to make that go a little smoother. We have our Memory Lane TVs, which it's a non-plot specific streaming TV channel that engages individuals through sensory stimulation. It promotes engagement, relaxation, and personal memories. Next, we have our robotic pets. which are for homebound individuals, those with more moderate to severe cognitive impairments. And we have this program, really, you could see the pictures here of the little dog. We have a dog, a cat, we have puppies and kittens, and we bring them with us because they can help reduce stress and anxiety, they can improve behavior, reduce loneliness, they can also enhance our clients' lives. And then last, we have our memory support coaching. Oh, also, I forgot to mention this radio here. This is something that we also offer our clients, so it makes it a little bit easier. So for those who can't use the MP3 players and would prefer to have a radio where they're listening to it, not having to put it on their ears, they can use a very simple radio that has just an on and off button, and it's very easy for the individual to use. The memory support coaching, these are personalized sessions for those living with dementia and their caregivers. It's provided by one of our staff who's a dementia specialist, and she comes to the home and she helps to enhance the engagement and the connection that the caregiver and the client have in the home environment. They enhance engagement and connection through activities that are appropriate for the stage of dementia that the individual is in. They give guidance and support to the family caregiver, and other support is identified. Next. So in addition to all the services that I've mentioned, we also offer a number of other supportive services. Many of these focus on helping to foster those social connections that I had mentioned. We have our friendly visitor program called One Good Deed, where volunteers are matched with older adults to reduce social isolation. These are volunteers that make a commitment to meet a couple times a month. Many of our volunteers interact with their care recipient much more often, and some have been with their matched person for 10 years or more and become like family, and say that they get more out of the program than even the person who's getting the visitor. Our transportation services are focused on coordination of rides, as well as wheelchair and monitored Lyft and Uber rides. We also have what we call our Age Well Atlanta neighborhoods, which provide services locally where clients live, with social programming, transportation assistance. We offer minor home repairs and assistive devices. And currently we offer the program in East Cobb, Toco Hills, and in the Sandy Springs, Dunwoody area. Our Holocaust Survivor Services program provides a full service program for Holocaust survivors. It's our niche program because we are a Jewish agency. This is a program that we get funding from the Claims Conference and from a number of private donors, foundations, to be able to offer assistance with in-home support, because going into a facility, a skilled nursing facility or assisted living can be triggering for someone who's experienced trauma. And so a lot of the funding is used for home care. We also have a number of case managers, including a couple that speak Russian, because a majority of those survivors are Russian speaking. And it comes with financial assistance, reparations, and also social programming. Next. Our Age Well Atlanta service, it is a central point of entry for us. So when people need services, they don't often know where to start, what services they need. So oftentimes the best way to get them is by going through and calling Age Well Atlanta, which is an INR line, 1-866-AGE-WELL, or our email. And our dedicated concierge, they answer the phone and they provide those who call or email with a warm handoff to our services within our network. We actually collaborate with 2 other organizations. It's the Jewish Home Life, which has all of the service lines that focus on long-term care, like home care, hospice, skilled nursing facility, assisted living, those different types of services. And then we also have the Marcus Jewish Community Center of Atlanta, which focuses on wellness and social programming for more active older adults. So within that continuum, we offer a number of older adult programming. So no matter where you are in that continuum, there's a service that you can access. And then the Jewish Federation is our planning and fundraising arm. And so we use this point of entry so our concierge can provide referrals and help people access our services more easily. So they get connected while at the same time learning about other kinds of services and getting referrals to other services, whether it's within our network or outside for other community-based resources. Next. So this is how you reach us. I had mentioned the number. The email is info@agewellatl.org. And these are the individuals. We have our manager, Jennifer Curry. We also have Lori Cohen and Darlene Prince, who are our two concierges that answer the phones. And they're a wealth of information. And they're going to be well-versed in all the different types of resources we offer and also beyond.
So,
Next.
Ms. Zisholtz, I have a question. This is Dr. Parker.
Sure.
This is a wonderful service, and I've been familiar with these services for a number of years, ever since we were at Wesley Woods Geriatric Center, which is no longer. There are some questions in the chat, but how are the Aviv Older Adult Services different from, let's say, the Alzheimer's Association, which offers case management?
Well, we do partner with organizations like Alzheimer's Association. Our case managers are not just serving those who have dementia, but we serve people of all types, all different types of needs, who are older adults, 60 and older. And oftentimes it depends on the type of funding that we get. So we do tailor our services based on the type of funding and what the funder wants.
The biggest thing is it's not just for Alzheimer's, and I wanted to stress that.
Correct. It's not just for Alzheimer's. And we have had them come and do programs where they've provided education services to our staff. And we've also, they promote our services, and when our services aren't at a good time or there's something different that somebody needs, we may refer them back to the Alzheimer's Association. So we work hand in hand together.
Okay. And if you look in the chat, there are people who are on this call who are from other areas. There's a question about whether or not there is a similar option or organization operating in Dade or Broward County, Florida.
Yes, we have a Jewish family service agency in pretty much every large city. Any city where there's a large enough population for a Jewish community, I would say. But we do have several in Florida, and I'm pretty sure in Broward County. If you Google Jewish Family Service and put your city in there or Florida, you'll see all the different agencies and where they're located. And you can do that for any city in the US.
So for some people who may have joined late, Dr. Parker is going to repeat that the services offered through the Aviv Older Adult Services, Jewish Family and Community Services organization are available to anybody regardless of what your faith or ethnicity is or your income level. It is not only for people who are of the Jewish faith. Again, these are services for any and all older adults, regardless of your faith and regardless of your ethnicity. Okay, and I think it's important to leave this number contact up here for people who have special interests and needs for respite care. You need to contact them and find out what it is that is available. And Ms. Zisholtz, for the record, people need to have, I think, a really good understanding of what respite care really means. So can you define respite care for people?
Sure. It's providing caregivers with a break. That's what respite means. And there are grants and services that are provided out there that specifically focus on trying to reduce stress and burden on the family caregiver. And so those are called respite services. And the way that we provide this service is through making home care, in-home services, and adult day programming more affordable for family caregivers. And we do this on the short term. So maybe like up to 4 to 6 weeks, we may be able to offer like a voucher, a certain amount of money per person per grant cycle. And so, you know, we have a manager who oversees that program and works with the person to determine like how many hours per week and how can we make it last as long as possible. It may be a situation where a client comes back from the hospital and maybe needs some additional increased support. And so during that period of time, while that person is recuperating or getting better to where they were before, that's a good use of those respite funds, because then it allows the person, the caregiver, maybe not to have to miss more work or to know that they have someone else they could lean on. It's an extra support for the family caregiver, and it's not based on income. The program that we have, it's based on need.
Okay, let me see what other questions I have here. What's in there? Anyone? Okay, the age well number is in there. We talked about ethnicity. We talked about availability to pay. And for one last question, okay, I know you're located here in Metro Atlanta, but for viewers that are from other parts of Georgia, does your service area go outside of Metro Atlanta?
But dear, I mean, for any service that we offer that's virtual, of course, people can participate from anywhere. Our Holocaust survivor program, it serves Georgia as well as the Southeast region. We do have staff that are serving people in other states where there may not be case management services for individuals available. And so we make sure that they get the financial assistance that they need. And then we have a few financial assistance programs that serve people in all of Georgia. Our respite program is more limited. So that would be the same county where the Atlanta Regional Commission serves, in the 10-county area in Atlanta. So it really depends on the program and the funder. But if it's something that I'm not sure about, I would always call our Age Well Atlanta line and find out and for sure if it's something that might be available to you.
So again, for the people who are listening, in case you missed something, if you have further questions about how to receive or how to get help for someone who is older, living in your home or elsewhere who needs assistance, please call 1-866-AGE-WELL. 1-866-AGE-WELL. Numbers 1-866-243-9355. 1-866-243-9355. And I see some of the questions. I don't see that many questions in here anymore, but these are really, really important questions to ask. People are asking about adult day care and short-term respite. So as she explained, respite is a break for the caregiver. Respite can be something that takes place over a couple of hours in a day. Respite can mean an overnight stay. Respite can mean relief from having to take care of my person during the day from 8 to 5 while I go to work. There are a number of ways to look at respite care. Respite isn't going to be something that's offered continuously 24 hours a day, 7 days a week, all the time. And there may be times where people will need that, but that's where sometimes we can find residential care for people who are going away. I know that a lot of the assisted livings used to offer like 1 week of respite care for families. You had to pay for it. It was like a hotel stay. post-pandemic, I'm not exactly sure how that works, but are those services available for family members, Ms. Zisholtz? Like
I-
short-term respite?
You
Like-
know, I have seen from some of our geriatric care managers, there are communities where senior living communities where they are still offering that service. So I believe maybe even Hunt Cliff Summit might be one of those. There's a few that do. So you just have to ask and find out.
Okay, let's see. Okay, we did put the numbers in. Okay, now I'm gonna ask this question, and this one's probably a little different. When it comes to, I'm gonna say palliative care and hospice services, is that something that your agency helps people with?
So you can get information and assistance with that by calling our Age Well line. It would not be through Aviv Older Adult Services, but again, we're part of this larger collaboration where we don't provide those, we provide the supportive services to help people stay independent in the community and where they live. Now, Jewish Home Life, which is one of the other collaborative partners, they do provide that, and palliative and hospice care is something that they do through Weinstein Hospice. And so that's a referral that might be made in network, but then if, let's say, it's not an appropriate referral for somebody because they don't live nearby, or they want something a little bit different, or they want a few additional choices, then that's something that our concierge can provide. And that gives people a starting point for where they might want to go. And we try to provide referrals based on the experience that our staff have had in those locations. So we're giving information based on our own personal knowledge about those services.
So one of the things that I appreciate about this organization and this agency in the community, it's not like they're going to give you a list of numbers to call or a number of websites. They actually do a warm handoff. A person actually talks to you and works with you to try to find a solution to whatever your particular problem is. That's not always available by people who give you a number line. I don't want to say, let me just be clear. There aren't very many agencies operating in the community that can provide directed personal care. And that's one of the reasons I did want Ms. Zisholtz or somebody from the organization to be here, because I think that so many of our families really don't understand the availability of services. The fact that you have somebody who can help you obtain services that are appropriate to your level of insurance, whether you have just Medicare or Medicaid or something else. And I think there's a question in the chat that just popped up that popped out because I can't read it. I should be putting on my glasses. Okay, can you use this service if your loved one is on Medicare and or Medicaid? And for the benefit of everybody there, everybody doesn't have health insurance or private pay respite services. So can we address that one, Ms. Zisholtz?
Yeah, we serve all different types of people's situations. So, you know, some people do, some people don't. Some people are asking for help in accessing those benefits. And so that's something that our case managers do a lot of work in. We can also, our concierges can point people in the right direction as to how they can get assistance with that through other resources outside of our agency. So we try to help people wherever they're at and go from there. And so we've also, in some situations with our case management grants, we've been able to help people in the short term while they're accessing those benefits and being able to help pay certain expenses in the short term while they're accessing that benefit until it kicks in and is able to then start covering certain costs. So we try to work with people however best we can, because we want to really create a bridge to that greater stability.